Hello, it's Dr. Rhonda Johnson, and today is Wednesday, January 11th, 2023. Today I'm talking about an important study looking at the safety of the COVID-19 vaccines. The bottom line, folks, is that research shows once again these COVID-19 vaccines are safe. Now, in this particular study, there was a large number of researchers from multiple research centers, and they conducted a large cohort study to evaluate the risk of non-COVID-19 mortality. That means people who died from deaths due to other causes besides COVID after COVID-19 vaccination. Now, they published their studies on an article on January 3rd. Now, the study looked at Kaiser Health Plan enrollees who had received one of the three authorized COVID vaccines in the United States. That was Pfizer, Moderna, and Janssen. Now, they assessed the vaccination status between December 14th, 2020 and June 30th, 2021. And deaths were assessed until August 31, 2021. Now, this study had more than 6 million recipients of people who had received the COVID-19 vaccines. They compared this to their unvaccinated group, and they found no increased mortality risk among people who had gotten one of these three COVID vaccines. In other words, folks, the 6 million plus people who got the COVID vaccine were not dying suddenly. They weren't dying from unexplained causes. All right, now their research was a very complicated model. They adjusted for individual level demographic confounders, clinical risk factors, healthcare utilization, and community level socioeconomic status risk factors. So, in translation, they looked at age, sex, race, ethnicity, Medicaid status, history of COVID-19 infection, outpatient visits, virtual visits, inpatient stays, and community characteristics such as income and education. And they had very complicated statistical models, and they tried to address confounding and bias. Now, like a good research study does, they noticed that the limitations of their study may be that they did not capture unmeasured confounding, and then causes of death were not available and included in the analysis, and it was an insured population, and it may not be generalizable to the general population. So in closing, folks, the findings of this study showed no increased risk of dying from causes other than COVID, and all causes of dying among people who got three widely used COVID-19 vaccines in the United States. Now, everybody was 12 and older in this study, and researchers hope to look at individuals who were 12 and under in future studies. So again, this should give people who are worried about the safety of the COVID vaccines. I do a lot of community outreach, and one of the reasons I heard for vaccine refusal and vaccine hesitancy was people felt that there wasn't enough data showing that the vaccines were safe. So this is one more study that shows the vaccines are safe, folks. That's my message today. Take care and be safe.